Do you think that leaders are born leaders, or are they made over time?
I think they're made over time, but I think they're born with a kind of a personality that puts them in and helps them develop into a leadership capacity. I don't necessarily think all leaders are just born. I think that they're born with a predisposition to leadership because of their personality, but then I think over time, by taking advantage of a lot of opportunities, they can be made into better leaders.
I think some people are born with more leadership skills than others, or the tendency to want to be the leader.
I think that everybody has to have some help to be a leader, that you have to have a mentor. And that's some clear from many articles I've read, is that having somebody you can go to that's going to push you, that's going to kind of mold you. With that being said, some people will take advantage of this and others won't. Some people are very happy not being a leader.
I do think that there are natural leaders, but I think you have to recognize that they may be leaders in some limited area. So like I'm good in certain things that I care about and I love. Others I don't, and I'm not. And so I think you need to know yourself, and you need to follow your passion and your heart.
In your own words, what qualities make a good leader?
I think a good leader has vision. It has to be visionary, be able to listen to other people and take it with a grain of salt, but not go kind of with the wind, is that make a decision, stay with it. A leader also supports their coworkers as well as the people underneath them. I think also a leader brings people up and does things to support other people to become leaders. So a mentorship with that.
I think, first of all, they have to feel passionate about what they're doing. They have to be committed to the leadership qualities or the leadership opportunities that may present themselves. They need to be visionary, and they need to be people that kind of look around the marketplace or the job situation, their profession, and kind of notice niches and gaps that need to be filled.
I think that through my experience, a leader needs to be a very good listener. I think a leader needs to really listen to what other people are saying and try to understand their viewpoints. I think it's important for a leader to be a good communicator. It still amazes me that you can have 5 people attending the same conference call or the same meeting, and you can have 5 different takes on what occurred at that meeting.
I mean, some of the people whom I've seen it to be the greatest leaders, they know who has what kind of strength. They also know where there might be some vulnerabilities. And the vulnerabilities may be situational, in that you work for some kind of a company or an organization that ain't going to go there, you know, or it may be just that person isn't going to go there. They can't go there. They don't want to go there, and not asking something that they can't do, but trying to always work for success.
How would you describe the difference between being a manager and being a leader?
A manager, to me, is somebody that can cross all the T's and dot all the I's, that keeps things running, that is the go-to person if you need something. Whereas a leader may or may not be a good manager. A leader is looking at the future, is looking at as a visionary, but listening to other people. I think good leaders hire or surround themselves with good managers. But I think that there's totally 2 different skill sets. Now, some people may have both, but I think that you have one or the other.
I used to always say that leaders do what's right and managers do it the right way. But as I've thought about it over the years, it almost means and implies that leaders do the right things and managers don't, and managers do it the right way and leaders don't. And I really don't think that's the case. I think both managers and leaders need to know what to do and how to do it. I think the distinction becomes in their focus. And so sometimes somebody's acting as a leader, sometimes they're acting as a manager. but when they're acting as a leader and they're helping to think about what needs to be done and why. And then the manager is thinking about how to do it.
What are some of the biggest challenges facing leaders today?
I think one of the biggest challenges is that it may be communication. And it may be the communication that I think is being driven by technology. I think it's a challenge that instead of having face-to-face meetings, we've gone to webinars, we've gone to conference calls, we've gone to Twitter, Facebook, whatever. Instead of, and it's very non-trendy to talk on the phone unless you're on a conference call. And I've seen a tremendous amount of change in organizations where they're so into the conference call that you hardly feel like you ever get to know those people that you're working with on a particular project. And I personally think it's a very non-productive thing, but I am totally out of step with what a lot of people think. It's all about money. That may be the biggest challenge, that people say, well, it's too expensive for people to get together. Well, it might be, but not maybe if you did it once a year.
Do you consider yourself an introvert or an extrovert? And in your experience, how do introverts and extroverts lead differently or the same?
I think of myself as an introvert. There are a number of inventories and assessments and so on that can be used in order to help you classify yourself and understand yourself better. And those are very useful because then not only do you understand yourself better, but maybe that helps you understand certain approaches or tools that you need to enhance in order to be more effective, given the natural style that you have. I think that you can be an introvert or an extrovert or anything along some continuum of that and be an effective leader. But the important thing is that you know more about yourself and what styles and approaches you're comfortable with and how that brings certain strengths forward for you, but also recognize the limitations of it so that you might say, well, if I know I'm an introvert, people who don't know me might think that I didn't have too much to say or that I was hesitant or whatever else. But people who do know me might say, well, she's sitting there, she's processing, and all of us, pretty soon she's going to be coming forward with some digested version of what we've all said, or being able to sum things up, or to be able to help us see some different perspective that hasn't been in the discussion so far.
Have you noticed that your leadership style has changed over time?
Oh, definitely. I've been in leadership for 30 years now. So if you look at the first 15 years, then you would see me as a leader that was always inviting myself to the table, making sure that nutrition and physical activity was part of the team, making sure that people understood how important we were and that we had skills. The second half, the last 15 years, have been a lot more fun because we've been established. They accept us as part of the team members. So now, instead of always trying to put nutrition and physical activity first, we're able to look at situations and look for the answer. It doesn't always have to be a nutrition answer, but we look to make the best answer. We look for partners instead of trying to prove it for ourselves, and it turns out to be a much easier win-win situation. But if you're starting out, you have to prove yourself. I don't think that would change, and I don't think if I went back, I would necessarily have to change, because in the time period, we did have to prove nutrition was important.
We used to have to fight to be at the table, and to have the word nutrition dropped in a list of everything else.
Right.
We always, we'd be reading over documents that somebody would write, and we'd say nutrition and, food and all that kind of stuff, and we don't have to do that anymore. And so for those of us at my level, sometimes we have to check ourselves and say, okay, we've got to move farther.
How do you think, when you're working with a team, how do you create that shared vision?
I think if I were to say it succinctly, it's to get buy-in and also to sustain an initiative. If people are involved from multiple perspectives, are involved in identifying the vision, what they want to be like, then they can buy into it if that vision is broad enough.
That's a big challenge, and it's something that's very important in public health nutrition right now, because so many things we do involve many organizations and many kind of people. In my work, what I see is one of the most important things is working toward the shared vision has to be an authentic kind of thing. An example that wouldn't be authentic would be some people figure out what they want to do in a way. We've got it. This is where we're going to go, and this is what it is. We're going to call together a group of people and get input, so they say. But what they may be really looking for is a rubber stamp.
But how have you personally dealt with organizational change?
Be sure you know your culture and make sure your culture fits into your organization for the best of both worlds. We had to realize that we had no drama in our culture. Other people were bringing drama in our culture. So what we did was we brought our culture to the office. And on Fridays, we selected Fridays because we were casually dressed and we started playing. On Friday at 2 o'clock, we'll be outside with the Frisbees, laughing. Before long, our invitations to the whole Bureau, we started getting more Bureau people to come down. Before long, those Friday afternoons had turned into Friday afternoon fun times. Now, we were careful with the time. It was a 15-minute break. We took our laughter, we had it, we got back to work. In the winter, we had them in the inside. We had stupid games, hula hoop, things that would make you laugh, a dance contest, and whoever won the contest on Friday was responsible for setting it up on the next Friday. So we were getting more of the Bureau involved. Long story, but the end of it is now other bureaus have looked at us and said, that's fun. And they've realized that a little bit of laughter at the work goes a long way. Because the staff is happy, they're working harder. They're enjoying what they're doing. They love it. They feel that they're part of a team. And now the nutrition and physical activity staff is going to other bureaus and teaching them how to have fun on Fridays. It's all part of making a healthy culture, a healthy work site. It's a balance.
So how do you deal with specifically negative feedback and use that from different people, especially when it comes from different levels of power and authority?
Maybe I feel bruised a little bit at first, but what I really believe about negative feedback is that it's that kind of feedback that helps you get better or to make your project better. And so you want that feedback in order to understand the various aspects of what's going on around here and how can we make it better. I think the worst situation is when you don't get feedback. Maybe not positive feedback or negative feedback. So that leaves you in a situation where you don't know. How are we coming across? How is this working out? How are people perceiving it? And so you often have to go out and elicit feedback, and you have to make people feel comfortable giving you feedback. And that might be true coming from people on your team or collaborators or other people in management teams or whatever, as well as even your supervisors or people up the ladder.
I think over time, I've been more receptive to feedback. I try to listen. It's very hard for me to listen, and so I really have to work at that. I also have been able to send things out for people to review, asking for critical comments. But I see what I enjoy the most about leadership is the visionary, is looking at the future. Where are we going to be in 10 years? Where are we going to be in 5 years? How do we bring this forward?
What are some of the personal and professional challenges that you've faced throughout your career as far as balancing your personal and professional life?
Yeah, I think, having the support at home is just critical.
That's probably one of the hardest to think about for anybody who's in a career or in a job. What I learned through a whole lot of trial and error, what worked for me, was one of the things I had to do was set priorities. And for me, my priorities tended to be my family, my work, and me. those three things that were, for me, what I was trying to juggle. And I had to really think about what were my priorities in each one of them, because we have responsibilities in all three areas. If you don't do your job well, you're letting the people down that you work with, and you're letting the people down that hired you. If you don't do well in your home and your family, you're letting your family down and yourself. And then if you don't take care of yourself, you're also letting all the other things down as well. Because if you don't take care of yourself, you don't do well at work and you don't do well in your home life. So you have to know that perfect balance isn't going to happen, but adequate balance is okay. And part of that adequate balance is knowing what you need to do to maintain that.
And when you're looking to hire a new employee, how do you decide if two people seem to have equal qualifications? How do you decide which one that you would hire?
They may have the same degree, they may have the same background, but then look at what your team, your existing team needs, and then look at the candidates. What do they have to offer that will make your team even better than it is? It may not be necessarily the education, but maybe it's the way they think. Maybe it's the way that they've been brought up. It's a different aspect.
Often I'll ask, what do you want to be doing in 5? What do you want to be doing in 10 years? To see where their vision is. If they want to be in the same job or doing the same thing in 10 years, then I don't see them as much of a visionary or a leader.
What is one mistake that you've witnessed leaders making more frequently than others?
I think the simple answer is micromanagement. I think when a leader starts managing, then they're not a leader anymore. And the leader who is always following up and checking and redoing what the employee is doing and not letting that employee make their own decisions and taking the project and running with it, that micromanagement tells the employee that they're not really that needed.
One mistake commonly made is fear of taking a risk. You get in a comfort zone, and to step out of that is difficult for a lot of people. So I think it's failure to take a risk or speak up when you know that this will work or you've been there before. Is go ahead and take a risk, speak up, or even volunteer to do something.
What other advice would you have for leaders when they're first starting out?
To find a good mentor and to find a good leadership program. And I say to find a good mentor casually. It doesn't have to be some type of agreement or contract, but someone that you can look up to and that someone feels comfortable in telling you, a new leader, to put family first. Not to get so enthralled in leadership that you forget what's really important, and that's family. The leadership courses that are available, whether it's through an MCH or whether it's through a discipline type, the public health department would have leadership courses. National nutrition practice groups have leadership. ASTPN, which is territory for public health nutrition directors, they have leadership courses. Those type courses in your field help you meet other people, and they help you understand that everybody has gone through what you're going through or has experienced something similar. You're not out there by yourself. I would tell somebody to get a good exercise program, to have fun and to be able to laugh, because you're going to be in stressful situations. Leadership is not always fun and glamour. It's a lot of hard work. It's a lot of rethinking. It's a lot of making plans. And it's a lot of negotiation. So in order to keep yourself healthy, get a good exercise plan so you can work off that stress.
I would advise them, if they were in the organization, to study the organization, whether they're in an agency, a public health agency, or are they in an to really study the agency and see what the goals of the agency seem to be and where they fit into that. And then, as I think I said a little bit earlier, looking around for the either the opportunities that you needed to lead your group in, or new ideas that need to be developed, and to be very creative. I think leadership does best when you're creative.
I found that so often in nutrition that we stay within our field. So looking outside the field, some of my best mentors have been physicians I've worked with, I know a psychologist early on, people in the School of Public Health that have issued that. So looking outside the box and being willing to take leadership from other people. And that's also take criticism. I mean, if it's not working well, make sure somebody tells you that you don't go along. So listening to other people too with that.
Because if you listen, you'll be amazed at what you pick up.
Definitely. We've heard that from almost everyone.
Everybody, we're all telling, and probably those of us that are telling you that never listened.
Well, I don't know about that.
Well, hopefully not.